Have you ever woken up with one arm feeling strange, your neck stiff, your head pounding, and wondered whether the way you slept could be putting dangerous stress on your body all night long? What if one of the most common sleeping positions, the one thousands of seniors use every single night without thinking twice, may quietly reduce healthy circulation, strain the neck, affect breathing, and in some people, increase factors that are linked to stroke risk over time? Tonight, we need to talk about this seriously. Because many older adults focus on diet, blood pressure, and exercise, but completely overlook the 8 hours they spend in bed. And according to many health experts, sleep posture is not just about comfort. It can influence how well you breathe, how your neck is aligned, how your blood flows, how often you snore, whether your body is under unnecessary stress while you are supposed to be recovering. In this video, we are going to break down the sleeping position that surgeons and other medical professionals often caution against, especially for seniors already dealing with high blood pressure, sleep apnea, poor circulation, diabetes, neck problems, or previous mini-stroke symptoms. We will also cover why this position becomes more dangerous with age, the warning signs your body may already be giving you overnight, and the safer alternatives that may help you sleep more comfortably while protecting your brain, heart, and kidneys, and blood vessels. Now, let's be clear from the start. No sleeping position directly guarantees a stroke by itself. But certain positions can worsen conditions that are already known to raise stroke risk, especially when they contribute to breathing problems. Lower oxygen levels, repeated pressure on the neck, poor spinal alignment, and disrupted sleep. That is where the real danger begins, because stroke risk is rarely about one dramatic event. It is usually about small, harmful patterns building up over time, night after night, month after month, until the body finally reaches a tipping point. And one of the most concerning positions for many older adults is sleeping flat on the back, in a way that encourages airway collapse, heavy snoring, and reduced oxygen during the night, especially when the head and neck are not properly supported. For some seniors, this position may seem harmless, even relaxing. But if you already snore loudly, wake up gasping, feel exhausted in the morning, have uncontrolled blood pressure, or have been told you stop breathing in your sleep, lying this way may be much more than a comfort habit. It may be part of a silent health problem that keeps your body under strain for hours at a time. Here is why that matters. When you sleep on your back, gravity can cause the tongue and soft tissues in the throat to fall backward, narrowing the airway. In younger people with strong muscle tone, the body may compensate better. But in older adults, muscle tone naturally decreases, tissues become looser, and the airway may become easier to block. That can lead to snoring, shallow breathing, or repeated breathing interruptions during sleep. And every time oxygen drops and breathing is disturbed, the body may respond with stress hormones. Sudden blood pressure spikes, changes in heart rhythm, and interrupted deep sleep. If this happens over and over again through the night, it creates a kind of hidden stress cycle that many people never notice until serious symptoms appear. This is especially concerning because sleep apnea, which often becomes worse in the back sleeping position, has been strongly associated with cardiovascular problems and stroke risk factors. Many seniors do not even realize they have it. They just think they are tired because of age, or they blame poor sleep on stress, frequent urination, or an uncomfortable mattress. But the real issue may be that their body is fighting for air, again and again while they sleep, and the warning signs can be easy to miss. Morning headaches, dry mouth, waking up confused, daytime sleepiness, trouble focusing, irritability, memory slips, and feeling unrefreshed even after a full night in bed are not things you should automatically dismiss as normal aging. They may be signs that your sleep position is making an underlying breathing problem worse. There is another issue too, and many seniors never hear about it. Poor neck positioning during sleep can also matter more than people think. If your pillow pushes your head too far forward, too far backward, or twists your neck for hours, it can place strain on muscles, joints, and blood vessels in the neck. While a normal pillow setup will not suddenly cause a stroke in a healthy person, chronic poor alignment can contribute to pain, dizziness, poor sleep quality, and discomfort that may worsen other health issues. For seniors with cervical arthritis, stiffness, balance issues, or vascular disease, that nightly strain is not something to ignore. And this is where many people make a costly mistake. They choose a sleeping position based only on what feels familiar, not on what helps them breathe best and keeps the body aligned. Familiar does not always mean safe. Comfortable for 10 minutes does not always mean healthy for 8 hours. In fact, one of the biggest dangers for older adults is that the body can adapt to unhealthy sleep habits so gradually that the problem feels normal. Loud snoring becomes normal. Waking up tired becomes normal. Needing a nap every afternoon becomes normal. Feeling pressure in the head when waking becomes normal. But normal does not mean harmless. It may mean your body has been compensating for too long. And the older you get, the less reserve your body has to keep compensating. That is why this conversation matters so much for seniors. With age, blood vessels become less flexible. The risk of high blood pressure rises. Heart rhythm issues become more common, and recovery from poor sleep becomes harder. At the same time, many older adults take medications that may affect breathing, muscle tone, or sleep depth, which can make a bad sleep position even more problematic. Add in extra weight around the neck, chronic nasal congestion, acid reflux, or sleeping with the wrong pillow, and suddenly a simple bedtime habit can become part of a much bigger health risk picture. So before you assume this topic does not apply to you, ask yourself a few honest questions. Do you snore more when you sleep on your back? Has anyone ever noticed pauses in your breathing? Do you wake up with headaches, brain fog, or a racing heart? Do you feel strangely exhausted despite spending enough time in bed? Do you ever wake up flat on your back after falling asleep another way? If the answer to even some of these is yes, then your sleeping position deserves much more attention than you may have given it before. Because in many cases, changing how you sleep is not about chasing a miracle. It is about removing one hidden source of stress from your body every single night. And that can make a real difference over time. That is why many sleep specialists and medical professionals often recommend that Worcel's Ruby Kiss. Worcel's Ruby Kiss. Only Ruby Kiss has the luxurious texture that glides Worcel's last. You know what? Worcel's last, and Lysol's last, Lassel's last. That is why many sleep specialists and Lassel's lasts and Worcel's last. Worcel's last. Prectusal by CSL, YS. Where's Slassel Prezet? Wes it, like, or at Sagarend at this slide is it. Seniors who snore heavily or have possible sleep apnea avoid spending the whole night flat on their back whenever possible. For many people, a side sleeping position, especially with proper pillow support, may help keep the airway more open and reduce the collapse that can happen when gravity pulls the throat tissues backward. It may also help with snoring, improve oxygen flow, and reduce some of the repeated stress that back sleeping can place on the body in vulnerable individuals. But posture alone is not the whole answer. The goal is not simply to force yourself into one position and hope for the best. The real goal is to create a sleep setup that supports breathing, circulation, and alignment at the same time. That starts with the head and neck. Your pillow should not push your chin sharply toward your chest, and it should not let your head fall too far back either. You want a neutral position where the neck feels supported and natural, not bent or twisted. If you sleep on your side, the pillow should be thick enough to fill the space between your shoulder and your head so the neck stays level. If it is too flat, your head drops and the neck bends. If it is too high, the neck is forced upward unnaturally. Both can create strain and poor sleep. Seniors who wake with neck tightness, tingling in the arm, shoulder pain, or headaches should pay close attention to this, because the problem may not just be age or arthritis. It may be the way the body is positioned night after night. Another important factor is what happens with the rest of the body. Some seniors sleep with the upper body completely flat, even when they have reflux, congestion, heart failure, or trouble breathing. In these cases, a slight elevation of the upper body may sometimes help reduce symptoms and make breathing easier. Even a small adjustment can matter. Others may benefit from placing a pillow between the knees while side sleeping to support the hips and lower back, which can make the position more comfortable and easier to maintain through the night. And for people who always roll onto their back without realizing it, simple tricks like using a body pillow or placing support behind the back may help keep the body in a safer position longer. Still, the most important message is this: if you have warning signs, do not treat them as a pillow problem only. Treat them as a health signal. Loud snoring, choking, or gasping during sleep, waking with a pounding headache, unexplained daytime fatigue, worsening blood pressure, and episodes of confusion or dizziness in the morning should not be ignored. These may point to obstructive sleep apnea or other sleep-related breathing issues that deserve proper medical evaluation. And this is where many strokes may be prevented, not by fear, but by finally identifying a condition that has gone unnoticed. For years, many seniors are shocked when they learn that their exhaustion, poor concentration, and morning discomfort were not simply caused by getting older. They were caused by poor oxygen during sleep and repeated stress on the cardiovascular system. Once the problem is recognized, there may be real solutions. From positional changes and weight management to nasal treatment, sleep studies, or breathing support recommended by a doctor. The key is catching the pattern early instead of dismissing. It is also worth remembering that stroke warning signs do not only happen during the day. If you ever wake suddenly with one side of the face feeling numb, one arm weak, speech that feels strange, severe dizziness, sudden vision changes, or a crushing headache, unlike usual, that is not the time to go back to sleep and hope it passes. Those can be emergency signs, and immediate medical help is critical. Too many people lose precious time because they assume they just slept wrong. Yes, sleeping wrong can cause stiffness and numbness from pressure. But when symptoms are sudden, severe, one-sided, or combined with confusion or trouble speaking, you must think bigger and act fast. So what is the safest takeaway for tonight? Do not panic about every sleeping position, but do respect what your body is telling you. If back sleeping makes your snoring worse, leaves you breathless, or causes you to wake feeling awful, that is not something to brush off. If your neck and head are poorly supported, fix that. Side sleeping helps you breathe better. Make that position easier and more comfortable to maintain. And if you suspect sleep apnea or another sleep disorder, bring it up with a doctor instead of waiting for a bigger health scare to force the issue. The body often whispers before it screams. For seniors, those whispers may sound like snoring, headaches, fatigue, dry mouth, poor memory, restless sleep, or morning dizziness. These may seem small on their own, but together they can point to a pattern that deserves attention. Protecting your brain does not only happen during the day with pills, walks, and healthy meals. It also happens at night with every hour of sleep that allows your body to breathe properly, recover fully, and avoid unnecessary strain. Sometimes the habit that feels most harmless is the one worth questioning first. So tonight, before you lie down the same way you always do, take a moment and think about whether your sleep position is truly helping your body or quietly working against it. A small change in how you sleep may not seem dramatic, but over months and years, it could help reduce stress on your heart, improve your energy, support healthier oxygen levels, and possibly lower the burden of hidden risk factors that no senior should ignore. If this video helped you, make sure to like, subscribe, and share it with someone who still thinks waking up exhausted is just a normal part of aging. Because sometimes one simple bedtime change can be the first step toward protecting something priceless, your brain.